profound, but very important in so many ways. For years, I noticed that other countries paid much less for drugs and pharmaceuticals than we did. But I don't mean 2% less or 10%, which would be good, but I don't mean 20 or 25 or 30%. I mean, sometimes we paid 10 times more, 12 times more, 13 times more than other countries, where people from our country would be seen going into Mexico and seen going into other countries, leaving on trips and bringing their drugs home because they'd get in London, they'd be able to buy a drug for 1/10 the price of what it costs in New York City. And I watched this, and I watched it during my term, and I didn't like it. I didn't like it, and it's a very complex system, but, you know, we're smart also, maybe much smarter than they are, and at some point, we had to figure out, and I heard it was the middleman. Nobody told me who the middleman was. Nobody knew who the middleman was. Nobody ever heard. All I heard is the middleman. I said, they've got to be the richest people in the world, whoever they are. We don't even know if there is a middleman. All I know is that the drugs were 10 times higher and sometimes more than that. And I really got into it over the last year, and I figured the whole system out. And for various and sundry reasons, the United States of America was being screwed, and we were being taken advantage of and being laughed at for years and years. And I said, it's not going to happen anymore. And I brought a great gentleman, the head of Eli Lilly, in, who's great. He really is. He's great. He's done a fantastic job, and others also of the companies. And I'd have it out with him. I had debates with him, actually, and pretty much it was a debate that was impossible to lose. You had to be a real bad debater to lose that debate, because they couldn't justify it. They tried to say, well, you know, we pay for research and development, and the United States has agreed to pay for 100%. I said, why? Why are we paying? And by the way, that wasn't even the number, because it's still way too high.